Diolch, Llywydd. My constituents have a challenging relationship with stroke services, unlike many other parts of Wales, due to us not having a district general hospital in Powys. The rural nature of Brecon and Radnorshire and the lack of stroke service provision makes treatment more difficult for my constituents, and many of them have to travel cross-border into Herefordshire and Worcestershire to receive treatment. A total of 150 people in Powys were admitted to hospital in England following a stroke in 21-22. Think of the difference that it could have made to those people if they could have been treated closer to home. For a long time, as the Minister knows, I've been calling for an acute stroke unit within Brecon and Radnorshire to ensure that people get timely treatment in our communities. This would be a massive boost to the people in my area who are desperately in need of modern and effective stroke provision. With strokes, the seconds and the minutes matter. People from Powys having to go across border for treatment is an unnecessary burden in time for those people who have suffered, and the lengthy travel times due to the lack of the hospital, as I've said, in Powys. And that makes death and disability more likely, because time saves lives. I was reassured, I think it was last week, to hear the Health Minister that you had plans for regional stroke services that are being worked on, but my residents need to know how many people in those will be able to stay in Wales for treatment instead of going into England, because the closer we can have stroke treatment closer to home, the better. And I think I'd like to hear more clarity from you when we're going to see those come into fruition. With strokes being the fourth leading cause of death in Wales, it's essential that people in mid-Wales have good, timely treatment and they're not passed over. Stroke provision must be a priority. And when we look at the Wales-wide ambulance response times, it seems to me and others that this is not currently a priority for the Welsh Government. That's why Welsh Conservatives are calling for a review into the benefits and the challenges of recategorising strokes as red calls instead of amber, and that's something that I hope the Health Committee can look into. This would be a recognition of the huge challenges that strokes pose, and a big step on the way to dealing with the problem, which will get worse before it gets better. Diolch, Llywydd.